The union's saying that deploying the army to Northwest health facilities is an insult to collective bargaining. Protests continue there over service delivery and poor leadership in the province. The union briefing a little earlier today, and eNCA's Erin Bates attending that briefing. Erin, good afternoon to you. And they were particularly irked by the deployment of the army, were they?
They were. They say that this is an insult to their collective bargaining, and it's simply a stopgap in a way, that there is going to inevitably be some negotiations between Nehawu and the Provincial Department of Health. The Secretary General for Nehawu also saying that the Health Minister's hands have effectively been tied, and they've gotten to the point where they've written to the Office of the Presidency asking for an audience with President Cyril Ramaphosa to try and explain their reasons for saying the Premier should be fired.
In fact, they weren't particularly complimentary about the Premier, were they? I think I'm looking at one of the posts that you put on your Twitter feed saying that he continues to be a pop star in the media. What do they mean? Yes,
that was the Deputy Secretary General of Nehawu, really casting aspersions on the kind of profile Mahumapelo has in the Free State and how things have been covered over the last week. They've also taken umbrage with the narrative that they are responsible for the deterioration in healthcare in the Northwest, saying many of the problems we're seeing amplified or kind of focused on in the last week have long existed. So issues like having a lack of supplies, medical facilities and equipment, low and delayed pay for staff members, and if anything, these are ongoing systemic problems which have simply come to the fore as a result of the state of the strike action the last week.
In fact, Erin, there are a list of 20 demands, many of which are going to be difficult to implement.
Yes, and today we heard that they're insistent those demands must be met before Nehawu members in public health care in the Northwest will resume work. Those 20 demands are, as you say, wide-reaching. They include suspending contracts with private companies, including Mediosa, as well as a Buthelezi EMS company, which was in the headlines in February over contracts with it. There are also sort of demands around pay, bonuses, contract, community healthcare workers. It's a very long and comprehensive list which speaks to a really poor state of healthcare and the relationship between public healthcare workers and the provincial department in the Northwest province.
And where does the National Health Minister fit into all of this?
So the National Health Minister has already engaged with Nehawu over the issues in the Northwest, and we understand that there is a meeting planned for Thursday this week. Nehawu's insisted that the strike action will continue, and as we've seen, it's become quite violent, deadly in one instance at least yesterday. They're insistent that action will continue until Thursday, when the Minister, the Deputy General of Health in national structures, as well as health officials in provincial structures and Nehawu representatives will all meet in the Northwest. But I did ask the Secretary General if there's any hope from their side in terms of speaking to the Health Minister, since they effectively say his hands are tied, he's unable to break into the kind of fiefdom they claim Mahumapelo runs in the Northwest. They seem open to the discussions on Thursday, but at the same time are hedging their bets in that they have written to the Office of the Presidency.
All right, just back from that National Education, Health and Allied Workers Union briefing in Braamfontein in Johannesburg. Erin Bates, thank you very much.